Thank you for staying with us. The advisor, Non-Communicable Diseases, Injuries and Mental Health for Africa CDC, Dr. Naeem Dalal, has stressed the need to stop cultural stereotypes that prevent African men from seeking emotional and mental wellness help. Dalal spoke with the news agency of Nigeria in Lusaka, Zambia, on the sideline of a parallel session on youth mental health in Africa at the International Conference on Public Health in Africa on Tuesday. The CPHIA, an annual event, is organized by the Africa Centers for Disease Control and Prevention, with the 2023 edition being hosted by the government of Zambia. According to Dalal, stopping cultural stereotypes is necessary, as statistics specifically show that more men die by suicide on the continent of Africa. To further discuss this, I have with me in the studio CEO, Soinex Medical Resources, Dr. Adekunle Abiona. Thank you very much, Doctor, for giving us your time.
Thank you. Thanks for having me. Good day.
How can we deal with the stereotype by African culture that men are meant to be strong, leaving them to suffer mentally in silence?
Well, it's unfortunate that Africa of today, men are are made to look like the stronger people. So even as children, we have been told that man up, be a man, men don't cry, take it as a man. All those languages can cause some form of stereotypes in the brain of men to make them not want to speak up. But then it's come to fore now that many men, about 3 times, men commit suicide 3 times more than women. And then, these are not just mere numbers, these are stories of people who have really gone through that depression slope into committing suicide. So it's important to encourage men to always speak up. Let there be a lot of awareness about this topic, and make sure that right from when young men are children, they should always encourage them to always speak up and also ask for help when needed.
With lack of funds to visit hospital, I mean, let's talk about many African countries now, Nigeria, for instance, and then you have the case of shortage of health professionals in the country. What is the fate of the common man on the street regarding checking their mental health status?
Well, in that space, doctors are leaving. There's almost nothing that is being done about that. But then, we shouldn't also neglect the fact that it all starts from somewhere. The whole mental health problems starts from somewhere, and it's important for a man or a woman to know at what point he or she feels he's getting off the line. At that point when you feel that what interests you no longer interests you, at that point when you feel that you're feeling sad, even when when everything is working for you but you still feel sad, at that point it's important to know that that is when to speak out. But then, who do you speak with? There are resources online. You have some online doctors who can speak with, because going to the hospital, is a far cry. And then having to spend money on consultation too, which might not be available. But then an average man has data on his phone, and he can also use that to access online medical help, and also speak to as much as possible people who he feels comfortable with. The aspect of counseling does not only rest on medical doctors. Aspect of counseling can also rest on religious leaders. It can rest on people who you think are older than you, or that are smarter, that you think are smarter than you, people who have gone through that path before, and reaching out to all these people can also do a lot of help, rather than having to go to the hospital all the time.
Stepping away from the blame game, you've already advocated some measures that can be taken. What should be the call to action as far as mental health is concerned in Africa generally? How can men, take away that stigma and remove the shyness that comes with seeking for help when they truly need it?
Right. So I keep saying something anytime I go for speeches. I say that a living dog is better than a dead lion. As a man, you probably have a lot of things you are holding on to and holding forth for, and you should look inwards and look at yourself and say, I don't want to die. Talk to yourself. When you see somebody around you who you think is down and needs some level of pat on the back, be that shoulder, be that hand around that person. We should also try to make sure we try to support ourselves, not leaving somebody to fall off the track. If you see somebody who is going through something, try to talk to the person. And also, it's important to encourage our children, male and female alike, that it is okay to speak up. It's okay to say what's on your mind. It's okay to show your concerns and cry if you have to, and don't bottle things up.
Doctors like yourself, I mean, you're the ones that provide the help. We know that there are cases where doctors are stressed, especially in a country like Nigeria, where the ratio of patient to doctor is still very unethical. So some people would say the number is just not right. What would you advise to doctors on how they too can manage their mental health? Are there provisions for their care, I mean mental health care in hospitals for doctors?
Well, I know a few colleagues who have suffered some mental health challenges. I know a few doctors who have also gone to the extreme to commit suicide. And in all honesty, we just have to look after ourselves, because a physician must heal yourself too. You must take care of yourselves in order to take care of others. That's what the Hippocratic Oath says. And it's important to speak up. That tops the crop, to speak up. Don't bottle things in, because the number of patients you see a day, the number of calls you get a day, the number of help you render a day is overwhelming. It's overwhelming, and at that point, I always try to tell people, speak up. Speak up.
You talked about men having access to data on their phone. These are men in mostly urban areas. There are still places across Africa, in rural communities, where men are more invested in making ends meet than accessing data on their phones. Some of them actually don't have internet on their phones. They just have their phones for calls. How can mental health care be assessed by individuals like this? Are you aware of any provisions being made for these people?
Well, for people who stay in the very rural areas, I don't know of any provision being made for them yet, but I believe that, I know that there are some NGOs who try to reach out to people away from town, and it will be a lot of advantage for them if awareness is also taken down to that area. Because, I keep saying awareness because people really know that they don't feel well, but they don't know what's wrong with them. A couple of times when I go for speeches, I go for mental health talks, and by the time you start mentioning symptoms, you see people telling you that you are speaking to them. So these things are around, but people just don't know that they are feeling it. So,
I guess awareness remains a very key factor to be addressed. Doctor, thank you very much for speaking with us.
Thank you very much.